to start now. So hopefully all of you are settled down and ready to hear. And I am the host today. My name is Subrata Chattopadhyay, and I am very thrilled to host this session today, welcoming and namaste for this special program on lifestyle disorders. Is it threatening us? And this is a great morning on Friday, and we are having a very special session with the Belgaum Police Department. I am delighted to welcome you all in this special gathering. Briefly speaking, we started just 2 years back and part of a SERIMED and a Reach Healthcare, and out of that, almost after 6 months down the line, IWSP was born, and where you will hear that straight from a doctor who actually now teaching other doctors how to live healthy and well. So he like to spend some time with you and answering some of your critical questions before he speaks. Incidentally, about last year, some of us like myself and my colleague Anirban joined the National Health Missions initiative where they're discussing how to set up the policy for the whole country, and it has taken a good long shape, and I'm very happy to tell that IWSP's all these principles they adopted in implementing that. And I was hearing just 2 days back in a news report, National um, Doctors Day was celebrated in memory of Dr. Bidhan Chandra Roy, who is one of the great doctor himself from West Bengal. Also, he was a chief minister of West Bengal. So in his memory, the National Health Day was celebrated, and there they announced that in throughout Karnataka, they're setting up a lot of clinics, and especially in Bangalore, there will be 250 clinics called Namma clinics. Those are coming up. I believe some of those, you will see some of those IWSP's components are getting integrated in this Namma clinics to take care of the people health across the state, and same thing are getting out throughout the country. So this is for our national scenario. And the next slide, I just wanted to mention that we try to get some data. What's the condition of Indian police today? Indian police is such a significant power and controlling for keeping on the government in totally and the society at large in a good shape. We, as a lot of people think they're all in a all age group, they're the healthy people, but somehow the statistics, even though little old, shows that each age group, whether they're 30, under 30 or above 40, there everybody has some prime kind of health issues when they go through a various check and test. So that is and unfortunately, that's not a, I would say, specific to police department. All government department, when we kind of collect this kind of data, people are so much involved in their work or stressed up, and we find the stress is one of the big bottleneck where we somehow is not physically seen, but it creates a great havoc on our whole lifestyle, whole way of living. And that's where you will see the IWSP brings the holistic way of taking care of the whole. And we have seen even specific information about Chennai police statistics. In the next slide, you will see that some of those statistics shows the type of disease which are people getting detected, and a lot of morbidities are stressed. On top of that is uh, diabetic and hypertension. So those are the biggest problem. This statistic hardly 2 years old. It should reflect this kind of prevalent disease which is affecting even our police department. So in that context, I really want to thank Mr. Anil Kumar, who is actually one of our first participant of IWSP Batch 1, and he's our role model for IWSP, and he gave us such encouragement that it will help, not only help himself, where we have his many videos we played to other future participants of IWSP. I really thank him profusely for supporting this event. Because of his initiative only, we could conduct this. He's a superintendent of police from Belgaum, Bagalkot, Bijapur, Dharwad, and Gadak area. And it's really we are thrilled to be associated with him and welcoming all the other staff from police department. And with this few words, and also I'd like to thank all the participants who are joining today. And I'm speaking in English. हम हिंदी में बात कर सकते हैं, लेकिन हमारा जो फैसिलिटेटर है डॉक्टर सुशील शर्मा, वो भी हिंदी में बात करेगा बीच बीच में. But today the video which he is going to deliver right now, that has mostly in English. The subject is oriented on Western science. That's why speaking is much easier. This kind of technical video हिंदी में बोलने से थोड़ा और कुछ दिक्कत हो सकता है, इसलिए हमारा कोशिश है फ्यूचर में वीडियो भी हिंदी में मिलेगा. But currently please bear with us. But question and answer session after the video, Dr. Susheel Sharma is very happy to introduce him. He is one of the senior consultant of cardiology from Maryland, USA, and he has more than 45 years of experience. He has practiced in Maryland, Baltimore, Washington Medical College, and other places. So currently he is traveling all across India and trying to even educate the various doctors to lead a healthy life, not only among them, and also teach the patients. So he will be with us, and आपके साथ वो हिंदी और इंग्लिश दोनों में बात करेंगे. With these few words, again, thank you very much, and we'll be now listening to Dr. Susheel Sharma about IWSP, what is the basic concepts, and how you're going to handle your health and wellness in that respect. Dr. Susheel Sharma, please.
Namaskar. What is the... Srutaji?
Yes.
You want me to say a few words? The presentation first.
Please, Sharmaji, welcome to our special program. So can you tell 2 minutes something before we start your video? Yes, Dr. Sharma, please.
Yes. So can I have a show of hands or somehow know what should be the medium of language? I can speak in English and I can speak in Hindi.
I think it will be a combination of both, because most of them understand English but comfortable with Hindi as well. That's what Mr. Anil Kumar, when you were talking to him, he mentioned that he should be both the language. I mean, Hindi में बात करने से ज़्यादा अच्छा रहता है, लेकिन English बहुत comfortable. ठीक है.
Anil Kumar से पूछ लो. I can do the whole talk in Hindi also if you want.
So that is after your video being played. So that's a Q&A session. For the time being, you just address in 2 minutes about your IWSP experience.
So IWSP stands for Integrative Wellness Science and Practice. ये प्रोग्राम 2 साल में हमने कोविड के समय से बनाया था. इसका उद्देश्य था कि कैसे कॉम्प्रिहेंसिव वेलनेस आपकी ज़िंदगी में लाई जाए. देखिए, आप डॉक्टर के पास जाते हैं, अस्पताल जाते हैं और आपकी इलनेस, बीमारी ठीक करते हैं, तो ये बहुत अच्छी बात है. डॉक्टर्स एंड हॉस्पिटल्स डू अ ग्रेट जॉब. क्या ऐसा भी हो सकता है कि हम ऐसी वेलनेस कर दें कि इलनेस हो ही ना? ये हमारा उद्देश्य है. तो 30-40 साल मैंने इंटरवेंशनल कार्डियोलॉजी करी, स्टेंट्स डाले. इस निष्कर्ष पे पहुंचा कि स्टेंट्स अच्छे हैं, काम करते हैं, बाईपास अच्छा है, काम करता है, दवाएं अच्छी हैं, काम करती हैं, लेकिन उनका जो प्रिवेंशन और रिवर्सल है वो इलनेस को ट्रीट करने से बेटर है. और वो आता है इंटीग्रेटिव वेलनेस से, जो हमारा प्रोग्राम है. उसमें से आज अभी आपके साथ हम डिस्कस करेंगे स्ट्रेस, क्योंकि ऐसा सुनने में आया है कि पुलिस फोर्स के पास आजकल बहुत ज़्यादा स्ट्रेस है, ना सिर्फ इंडिया में पर अमेरिका में भी. वो अपनी जान पे खेल के हमारी जान बचाते हैं. वो सुबह से शाम तक स्ट्रेस में रहते हैं. तो कैसे उस स्ट्रेस से जूझा जाए? तो पहले टू सुब्रतो जी.
Thank you. So now listen to this video, please.
Hello and welcome to IWSP. I'm grateful and thankful that you joined. It's been a year since we started these programs. Over 500 people have benefited, and we're going to have a wonderful time together for 1 month for going through life transformation and benefiting and getting good health. We did this program together on ourselves first, and then we saw our own numbers change. Our cholesterol come down 20%, our health got better, and then we thought, why not make it a general program? And that is where Subratoji, Nareshji, and Anirbanji got together with us, and IWSP was born. And then we had 5 batches, 500 people, and very many happy people. And now we want to share the same science, same program, and same practices with you. Okay, so this is the year of COVID. I know you've heard a lot about COVID, but I am talking about COVID from a different perspective. If you really look at, this is just the data from New York, but this is echoed all over the world. If you look at the people that had the highest mortality, they had few things in common: blood pressure, diabetes, high cholesterol, coronary artery disease, old age. So if you put the top 4 of these together, hypertension, diabetes, hyperlipidemia, along with obesity or overweight, it's a constellation of symptoms which is called metabolic syndrome. And this is a strong predictor of mortality from COVID, because this is the group that has lowered immunity. So basically, if you have COVID and you have metabolic syndrome, you have a higher mortality. And metabolic syndrome also is the one that contributes to other illnesses like heart attack, stroke, blockages. So all that blood pressure, diabetes, cholesterol, overweight, this is all a component of this metabolic syndrome. And the good news is that this metabolic syndrome can be managed and treated with a lifestyle change that you're here to discuss and learn today. So some of you may know these beautiful people accomplished in their own field and done great work in the field of entertainment and medicine. And if they knew that there are simple tests available that you can do today to detect whether you do or you do not have a predisposition to have a heart attack and sudden death, and if they knew there are simple ways to change your lifestyle to prevent heart attack, these beautiful people would be with us all today. But anyway, from their tragedy, we learn a lesson. And the lesson is that we need to take care of our health. We need to do simple tests and learn them in this program that we can do to see if we have beginning of the problems that they had and we do not end up being the same way. Okay, this is one figure I want you to remember, 80%. Now that's a pretty high percentage, right? So if you really look at these 9 illnesses that I'm highlighting here, high blood pressure, high cholesterol, diabetes, overweight, heart attack, stroke, dementia, kidney disease, and some cancers. Now, some of you may have it and some of you may not have it. And those that do not have it, I can tell you, you have an 80% chance over lifetime to develop these. So what else is 80% about it? No matter how we die, we may die from a stroke, a heart attack, or a cancer, or kidney failure, or anything else. There's an 80% chance the cause of our death will be the consequence of these 9 conditions that I mentioned there. These are called lifestyle illnesses. What else is true? If you really look at all the money that you're going to spend over your lifetime on your health, 80% of your health budget will be spent on managing either blood pressure, diabetes, cholesterol, heart attack, stroke, dementia, kidney disease, cancer. You get kidney failure, you have a recurring cost of dialysis. You get a heart attack, you have
exorbitant one-time cost of bypass surgery. If you have stroke, you have tremendous recurring cost of getting physiotherapy and care. And at the end, there's a good news. And the good news is that if you practice the lifestyle change that we are going to talk to you over the next 1 month in a set of 12 lectures, 45 minutes a day, giving you all the scientific data, you have an 80% chance of either managing, improving, or curing these illnesses. So if you practice integrated wellness science in practice, if you follow our DASH program that we have, then you should be able to eliminate these illnesses through change in your lifestyle. Now, you all know there's some risk factors for heart disease. In my case, is my family history, right? And as my age advances, I have a chance of getting heart attack. And also gender, I'm male. Male have a higher chance of getting heart attack. So my age, my gender, my family history is stacked against me, but none of this I can change. This is the card that I've been dealt with. But I have blood pressure, diabetes, high cholesterol that I can control. So I do not have blood pressure, do not have diabetes, do not have cholesterol, because I knew that my age and my gender and my family history stacked against me. I had to change my lifestyle and not to get blood pressure, not to get diabetes, not to get high cholesterol. How did I do it? I did it with lifestyle. I decided not to become overweight. I tried to stay active and do regular activity, exercise and yoga, eat very healthy diet, which I'll discuss with you. I don't smoke. And I try to manage stress as best as I can. But you all know stress is part of life and we all get stressed out from time to time, but I try to do my best. And this is what you also have to do with us when you do this program. So what is lifestyle briefly? It is the way you eat, the way you move, the way you have certain habits and addictions, the way you control your stress, the way you sleep, and the way you maintain relationships around you. All these, your psychosocial setup, they all have an impact on your lifestyle. And this is what really finally ends up leading to that metabolic syndrome if you do not do it the right way. So is it tough? No. Look at Bill Clinton, American president. He had bypass surgery, then his bypass closed, then he had stent, and then again stent, and then again stent. And he finally realized that is not the answer. The answer is to change his lifestyle. And I'll talk about who he talked to for his lifestyle change. You'll see in subsequent third or fourth slide. He called in Dr. Esselstyn to his office, who modified his diet, changed his lifestyle, and you see the change that he had. And on the right panel is one of our own. He attended the IWSP and he was kind enough to give us his pre and post pictures, transformed. And this happened in 6 weeks. So when you do 4 weeks of IWSP program with us, you will change. Your lifestyle will change and you will feel the benefit. And then this program that you do for 1 month then buys you a ticket to do IWSP Live with us for the whole year at no extra cost. And that is where you really see the transformation. And the transformation is as profound as the transformation of a little larva that becomes a pupa and then becomes a beautiful butterfly that flies off. This is a drastic change that you'll see in your lifestyle. And this is what is going to prevent metabolic syndrome. This is what's going to reverse your diabetes, reverse your cholesterol, obesity, high blood pressure, prevent your heart attack, prevent your stroke, treat your kidneys, improve your lungs, prevent dementia, and prevent some cancers. Okay, so let's take a few examples. Now, obviously, I can't talk about all 9 because time doesn't permit, but I'm going to talk about some of them that are common and you may have in mind. So this was a pioneer trial, and this is, by the way, Dr. Esselstyn in the right inset. He is the doctor that Bill Clinton invited to change his lifestyle. And the left panel, you're seeing some angiograms, and the white image actually is the artery. And even without you being cardiologist, you can note that some arteries in the left panel are pinched and the subsequent panel are opened up. Now, these arteries opened up not with a medicine, not with a stent, not with bypass. Dr. Esselstyn published this paper, pioneer paper, where he opened these arteries with diet alone. This was only treatment. Dietary treatment was the only treatment offered by Dr. Esselstyn. And he had patients that came to him with blocked arteries who were going to have stents put in, going to have bypass surgeries, that had heart attacks before, and they unblocked their arteries by changing the diet alone. So what was that diet? Well, we're going to talk about it. Now, this is, let's say the left panel is somebody who's overweight and he wants to look like the one who's on the right side. Now, first of all, let me clarify here. I do not like the word obesity. We are not doing this program for some kind of vanity or for some kind of size and shape that you need to look at. We are really doing it for lifestyle change. You could look exactly like the guy in the left panel, but you change your lifestyle and get all the health benefits without actually changing your shape. We're not here for body shaming. We're not here for vanity. We are here for transforming your life. So also, whoever you are, wherever you are, whatever you look, you're beautiful for IWSP. And you should like and you should love yourself. And this is also part of one of the practices that you'll see in stress management that emphasize you have to like yourself and you have to love yourself. If you don't like and love yourself, how can you like and love somebody else? And therefore, you have to practice self-compassion, and we'll have a detailed session on self-compassion, how to practice self-compassion, improve your self-image, like yourself, love yourself, and love others. Anyway, so this person says, I have too much fat in my body. I have an obesity. I need a solution. I need to look like the guy in the right-hand panel. Okay, so this guy eventually looked like the guy on the right-hand side. All the fat was gone. So what did he do? Well, he had some hormone injections to burn his fat. He took some pill to kill his appetite, stopped eating, and lost weight and became thin. It didn't work completely. He had gastric bypass surgery. He made his stomach shrink. And whatever extra fat was left there, he went to a dermatologist and had liposuction done. So if you look at all this, there are modern scientific methods available to make you look like whatever you want to look like. But you have injected some pills in your body, you injected some hormones in your body, you have done some surgeries on your body, and you've done some cosmetics and liposuctions on your body. And that is what makes you look like the guy on the right-hand side. Now, all of you might think that is a good thing. Is it good? I don't think so. Let me tell you why it's not good. Your outside may look as thin as it is, but there are problems on the inside. Now this person feels nauseated and dizzy because his stomach clipped, he has low blood sugar because there's dumping, he has malnutrition, he has some vomiting. After eating a little bit of meal, he becomes bloated, he has distension, post-surgical strictures come in, post-surgical ulcers come in, gallstones come in, hernia can happen, bowels can have problems. All these things can happen to this guy. Unfortunately, he has not reduced his risk of heart disease, stroke, and cancer. That did not change because all that changed was the way he looked on the outside, but the inside was unhealthy. And therefore, he did not get any benefit of change. So problem, he's obese. And that obesity predisposes him to metabolic syndrome, which can cause high blood pressure, diabetes, cholesterol, heart attack, and stroke, right? And that is because there is too much fat in the body that has gone in because of certain reasons. Well, what do we suggest? We say treat the cause of the cause. The fat is the cause of metabolic syndrome. Well, how did the fat get there? That cause has to be treated. And that is what we addressed in IWSP, how to remove the cause of excess deposition of fat in the body. And how do we do that? We do that with lifestyle change. And that's all this program is about. It is going to change your lifestyle. What is a lifestyle? A lifestyle is which is stress-free. Stress is a silent killer, and we all have stress. And do you know that 80% of the time you visit a doctor, that illness has some component of stress in it. If it's your blood pressure, there's component of stress. If there's cholesterol, there's component of stress. If there is sugar, there's component of stress. It accounts for the third highest healthcare expenditure. And unfortunately, only 3% of physicians really address stress. We address stress in a very deep way. We tell you exactly where the stress comes from. How do you deal with the stress? What are scientifically proven methods of de-stressing and preventing the effect of stress on your body? Because stress leads to cortisol secretion. Cortisol secretion leads to obesity and truncal obesity and metabolic syndrome. So let's look at another area. Let's say you have headache. You go to your doctor, he checks your blood pressure and he says, oh, you have high blood pressure and it is causing your headache, but you want your headache to go away. He says, okay, let me check your blood pressure. Your blood pressure is 145/90. Well, you need to take a capsule, and he gives you a capsule for blood pressure. Now, let's say after a few days, your blood pressure has not come down, and that actually was the lowest blood pressure. And the next time the blood pressure is even higher, 160/100. What does he do? He says, okay, well, if it's 145/90, you need one pill. If it's 160/100, you need two. Now there's a second blood pressure pill added. Then you go back to him. Now your blood pressure is even higher. It's 175/110. Why is this happening? Because there is something that is a cause of blood pressure that you're not treating. You're basically treating a number, suppressing a number with a medication, and it ain't going to work. Now he adds a third pill. So each pill of blood pressure lowers blood pressure by about 10 to 15 millimeters of mercury. So if you're at 175/110, you're now going to need 3 different medications, and you have to deal with their side effects and you have to deal with their cost. This is a lifestyle study published and recommended by American College of Cardiology. If you look at things mentioned on this, it's a busy slide. Don't worry about it. We'll put it on WhatsApp for you. But each of these components can reduce the blood pressure by 5 to 10 millimeters of mercury. Now remember, collectively, if you did all of them, you improved your blood pressure by 40 millimeters of mercury. Remember, I told you one medication lowers blood pressure by 10 to 15 millimeters of mercury. So if you did this lifestyle change, you effectively eliminated 3 blood pressure medicines if you're taking. So if you're on 1, it's gone. If you're on 2, it's gone. If you're on 3, it's gone. Just by the lifestyle change. And every piece of information published on this slide is backed by scientific data. So your wellness key, we say, in the integrated wellness and science and practice is our DASH program. So what is DASH? What we believe is that if you make positive changes in your diet, your activity and sleep, stress management and habit change, in these 4 areas, if you make significant changes, that is what really you need to change your lifestyle to get all the benefits that we talked about. Now, diet, right? We'll talk about diet. Some of you may say, oh, well, doctor, I don't need to attend this program. I eat vegetarian diet. This is a study recently published in 2017, where they looked at people from Nurses' Health Study and physician studies, that people that ate vegetarian diet, but unhealthy vegetarian diet. So a vegetarian diet can be healthy plants and can also have unhealthy plants. If you're eating unhealthy plants, unfortunately, your health was worse than people that were eating animal food and meat. So just because you're vegetarian does not mean you're eating healthy. You have to eat healthy plants, healthy vegetarian diet to be healthy. And we're going to talk about that. So why should your diet change? This is Dr. Dean Ornish, and his was the very first study published in New England in Lancet. Can lifestyle change reverse heart disease? And it demonstrated by changing the lifestyle, you can actually prevent blockages developing in your arteries. This was the landmark study. And based on that, we think the first component that we have in a dash is on the diet. And in the diet, we're not just going to tell you eat this and eat that and this carbohydrate, this protein and this fat. No, that is not what we talk about. What we talk about is the diet that makes a difference, which includes not just instructions on what to eat and what not to eat, but also how to eat. We'll take you through the anatomy and physiology of digestion, why certain foods are not good for you. Why are you having bloating, insomnia, indigestion, heartburn, sour eructations, inability to sleep, all these things that you're getting. Why are you getting them? Because you're eating wrong food the wrong way. Okay, so if I ever told you that there was a wonder drug available for wellness, it's affordable, it has no side effects, it can reduce, as published in the studies, your heart attack risk by 40%. It can reduce your diabetes risk by 50%. It can reduce your stroke risk by 27%. And it can reduce your cancer risk by 50%. And if I tell you it has no side effects and it's free, almost, would you now want to take it? Yes. And that X is physical activity. Physical activity is the closest thing we have to a wonder drug. Now, in this program, we're going to give you lots and lots of scientific studies, and this is one of them. Across the board, they looked at people that did very little exercise, some exercise, and significant exercise. And whether they had high blood pressure, diabetes, smokers, obesity, high cholesterol, COPD, everybody that did some kind of exercise more than what he was doing before had better result. All the people across the board that are active have lower incidence of blood pressure, lower diabetes, lower heart attack, lower stroke, and lower cancers. And in the activity, you're going to learn the science of activity, and you're also going to see the benefits of yoga. Now, we recommend yoga as the preferred method for physical activity, and I'm not going to talk about it because Swamiji has a detailed presentation to follow on it. But we're going to tell you exactly what kind of activity you should do, how long you should do it, how often you should do it. Along with activity, we will also tell you what is the science behind rest and rejuvenation and sleep, why sleep is important, how many hours of sleep do you need, and what is sleep hygiene. Just like there's a hygiene that you do with wash your hands and social isolation and all those things for COVID, there's a sleep hygiene. If you don't follow those hygienic sleep principles, your sleep is going to be disturbed. So if you're not sleeping well at night, wait and see the program, and you will find out very simple ways of how to improve your sleep. For stress management, we have picked up these 9 practices that we'll discuss in detail. We will discuss the scientific study behind each one of them, and we will prove to you how each one of them stand alone is capable of long-term stress management, and how you could pick 1 or 2 or 3 and deal with stress on a daily basis. Making stress go away or hoping and wishing stress go away is not living. As long as you live and I live, there'll be stress. We need to strengthen our mind and our coping mechanisms of how we can deal with stress. And we give you scientifically proven techniques for stress management. Now, habits. Now, eating again is a habit. Drinking is a habit. Smoking is a habit. Most of the things, not exercising is a habit. So this is one of the studies that we'll talk about. And this gentleman was a New York Times reporter who did some research on his own on habit and came up with this beautiful book by Charles Duhigg, The Power of Habit. And we'll talk about his habit loop theory also, how scientifically, actually, by tweaking the loop, you can change habits. We will discuss the science of habit. We'll tell you how neuroplasticity forms, how when you do certain things in a certain way in your brain, a channel forms, it gets strengthened and it becomes a highway. And no matter what you do, the information always travels on that channel. And how do you then change that channel? And that is the habit change. And what is the science behind it? What works, what does not work? You can only change the habit with a scientific way. There is no pressure, shaming, blaming, beating up, insulting does not change habits. Okay, so why should you then do IWSP? Because, as I told you in the beginning, everything that we'll present to you in this integrated wellness science and practice program will have scientific data behind it. We're integrating the modern science with our ancient yoga Vedanta knowledge. And you will learn meditation, you will learn pranayama, and you will learn yoga live with Swamiji. And it's experiential. You will do it live together. And what changes we are bringing up in our lifestyle, we are sharing with each other on a daily basis on WhatsApp. What we eat, we're going to share. How much we moved, you're going to share. So this connecting and sharing and caring and learning together is really a unique component of IWSP. And that's exactly the reason why we think that you should come and listen to us. You should know the scientific facts. You should practice those scientific facts. You will then have your own experience, and then you have your experience as your best guide and motivator for you to change your lifestyle. So this program will be spent over 12 sessions. Today was the introductory session, and then there'll be a session to follow where I will discuss really what is the pathologic internal mechanisms that cause these problems. And you'll hear some beautiful new theories, new things that you may not have heard before. Chronic inflammation, which is so topical these days, how inflammation predisposes to infection. And in fact, all these metabolic syndrome patients in COVID that had high mortality also had pre-existing inflammation in their body. And there's a food that predisposes you to inflammation. There's a lifestyle that predisposes you to inflammation. So there is a pro-inflammatory way to live, and there's an anti-inflammatory way to live. You will find out what damages the inside of the lining of your blood vessels, the endothelial injuries, what is circadian imbalance, why you need to have a balanced life, and what is autonomic imbalance, and how that gets corrected by pranayama and yoga. You'll learn the science of that. We'll devote 3 full sessions to diet. I'm going to talk about the anatomy of digestion, healthy and unhealthy food, how to eat, what to eat, when to eat. Every question about that will be answered. We'll have 2 sessions on activity, 2 on stress, 1 on habits, and then in the end, I'm going to add 4 more pillars. Why you should need sunshine, how do you improve your sleep, how do you get circadian alignment, how do you know your numbers? Remember I told you right in the beginning, if those people knew by doing certain tests where the numbers stand and what they had, they could have taken preventive measures and unfortunately not had to succumb to what they succumbed to. And we don't want that to happen to you. And therefore, we want to share that with you, that all that information. And in the end, we're going to go ahead and sum it all up for you. So remember, you owe it to yourself. What you plant today, you will harvest tomorrow. The kind of lifestyle that you have today is going to determine whether you do or do not progress to have those illnesses that we talk about. So the onus is upon you to plant the seeds of a healthy lifestyle today. And also remember, goal without a plan is just a wish. You really need to know what works and what doesn't work, and then have a plan to do that. Do not practice unscientific methods, because if the method is unscientific, the outcome will be unscientific. It's not going to help you. So see what works, see what's published, see what's good for you, and come and join us. And please commit yourself to this program. And the more we do it with you, the more we learn, and the more I research about it and share it with you and benefit from you. So really, when you join this program, in a very large way, really, you're helping me also. And I'm very grateful to you for that. And on behalf of the team, I invite you all to come join us, and let's begin the session and do all this journey all over again together. And this will be a great time together for all of us. Thank you very much. Namaskar. Thank you.
Thank you. Thank you, Dr. Sharma, for this wonderful intro on IWSP. Now, I'll request Mr. Anil Kumar, who has seen this program, attended this program, to unmute and speak a few words before we start our Q&A session. Anil.
Yes, sir. Can you hear me?
Yes.
Will that be okay if I talk in Kannada, so that other staff members will also understand. Or else if you want to talk to me in English or Hindi, it's okay. For me, all the three languages are okay, whether it is English or Hindi or Kannada.
Hindi and Kannada, if you mix, then it's good. Because Kannada, I think,
do it in
I'm
Kannada,
fine, but
because I'll be covering Hindi, English, you do Kannada, then I think we have all three, so that'll be good. So you do Kannada.
that's
That'll be
Yes,
nice.
sir.
Yes,
Yes,
please.
thank you very much, sir. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ಅನ್ಕೊಂಡಿದ್ದೀನಿ ಈ ಇಷ್ಟೊತ್ತವರೆಗೂ ಏನು ನೀವು ಈ ಪ್ರೋಗ್ರಾಮ್ ಅನ್ನ ಕೇಳಿದ್ರಿ, ಶರ್ಮಾಜಿ ಅವ್ರು ಮಾತಾಡಿದ ಬಗ್ಗೆ ಬಹಳಷ್ಟು ಜನಕ್ಕೆ ಏನ್ ಮಾತಾಡಿದ್ರು ಅವರು ಅಂತ ಅರ್ಥ ಆಗಿರ್ಲಿಕ್ಕಿಲ್ಲ. ಬಿಕಾಸ್ ಅವ್ರು ಮಾತಾಡಿರ್ತಕ್ಕಂಥದ್ದು ಸ್ವಲ್ಪ ಟೆಕ್ನಿಕಲ್ ಆಗಿತ್ತು ಮತ್ತು ಅದು ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಇದ್ದಿದ್ರಿಂದ ಬಹಳಷ್ಟು ಜನರಿಗೆ ಕೆಲವೊಂದು ವಿಷಯಗಳು ಅರ್ಥ ಆಗಿರ್ಲಿಕ್ಕಿಲ್ಲ. ಬಟ್ ಅದು ಮೊದಲು ನನಗೂ ಕೂಡ ಹಾಗೆ ಅನಿಸ್ತಾ ಇತ್ತು. ನಾವು ಈ ಪ್ರೋಗ್ರಾಮ್ ಅನ್ನ ಅಟೆಂಡ್ ಮಾಡಿದಾಗ 2.5 ವರ್ಷ ಆಯ್ತು. ಅವರಿಂದ ನಾನು 2020 ಕೂಡ ಜಾಯಿನ್ ಆಗಿದ್ದೀನಿ. ಅವ್ರು ಏನೇನೆಲ್ಲ ಹೇಳ್ತಾರೆ ಶರ್ಮಾಜಿ ಅವರು ಈ ಲೈಫ್ ಸ್ಟೈಲ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಬಗ್ಗೆ, ಅವ್ರು ಏನು ಆ ಡ್ಯಾಶ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಹೇಳಿದ್ರು, ನಾನು ಅನೇಕ ಸತ ನಿಮ್ ಜೊತೆಗೆ ಮಾತಾಡ್ತಾ ನಾನು ಹೇಳಿದ್ದೀನಿ. ಡ್ಯಾಶ್ ಅಂದ್ರೆ ಏನು. ಹಲೋ ಹಲೋ, am I audible?
Yeah, please continue.
Yes, please continue.
ಅದೇ ನಾನು ಅನೇಕ ಸತಿ ನಿಮ್ಗೆ ಬೇರೆ ಬೇರೆ ಸಂದರ್ಭದಲ್ಲಿ ನಾನು ಮೀಟಿಂಗ್ ತಗೊಂಡಾಗ ಇದು IWSP ಪ್ರೋಗ್ರಾಮ್ ಬಗ್ಗೆ ಅನೇಕ ನನ್ನ ಅಧಿಕಾರಿ ಮತ್ತು ಸಿಬ್ಬಂದಿಗಳಿಗೆ ಹೇಳಿದ್ದೆ, ಅದು ಮಾತ್ರ ಏನು ಅಂತ. ಅದರಲ್ಲಿ ವಿಶೇಷವಾಗಿ ನಾನು ಡ್ಯಾಶ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಬಗ್ಗೆ ಕೂಡ ನಿಮ್ಗೆ ಹೇಳಿದ್ದೆ. DASH ಬಗ್ಗೆ ಅವರು ಮತ್ತೆ ಈಗ ಅದನ್ನ ನಿಮ್ಗೆ ತಿಳಿಸಿದ್ರು. ಸೊ ನೀವು ಈಗ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಅದು ಏನು ಅಂತ ಹೇಳಿ ನೀವು ತಿಳ್ಕೊಂಡಿದ್ದೀರಿ. ಮತ್ತೆ ಅನೇಕ ಸಂದರ್ಭಗಳಲ್ಲಿ ನನಗೆ ಟೈಮ್ ಸಿಕ್ಕಾಗ್ಲೆಲ್ಲ ಕೂಡ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೆ, ಯಾಕೆ ನಮ್ಮ ಲೈಫ್ ಸ್ಟೈಲ್ ಚೇಂಜ್ ಮಾಡ್ಕೊಳ್ಳೋದ್ರಿಂದ ಏನೇನೆಲ್ಲ ಆಗಕ್ ಸಾಧ್ಯ ಇದೆ, ನಮ್ಮ ಡಯಟ್ ಅನ್ನ ನಾವು ಚೇಂಜ್ ಮಾಡ್ಕೊಳ್ಳೋದ್ರಿಂದ ಏನು ಆಗತ್ತೆ. ಬಾಟಮ್ ಲೈನ್ ನಾನು ನಿಮ್ಗೆಲ್ರಿಗೂ ಹೇಳ್ದಂಗೆ, ನಾವು ಸುಮ್ಮನೆ ಬೇಡದಾಗಿದ್ದೆಲ್ಲ ತಿಂದ್ಕೊಂಡು ನಮ್ ಕೈಯಾರ ಸ್ವಯಂಕೃತ ಅಪರಾಧ ಮಾಡ್ಕೊಂಡು ನಮ್ಮ ಜೀವನವನ್ನ ಹಾಳು ಮಾಡ್ಕೊಳ್ತೀವಿ, ಬೇಡದಾಗಿದ್ದೆಲ್ಲ ತಿಂದ್ಕೊಂಡು. ಅದೇ ನಾವು ಏನ್ ತಿಂತೀವಿ, ಯಾವ್ದು ನಮ್ಗೆ ನೈಸರ್ಗಿಕವಾಗಿ ಒಳ್ಳೇದು ಅಂತ ಅನ್ಸುತ್ತೆ, ಅದನ್ನ ನಾವು ತಿಂದಿದ್ದೇ ಆದ್ರೆ ನಮ್ಮ ಅದು ದೇಹಕ್ಕೂ ಒಳ್ಳೇದು, ಅದರಿಂದ ತುಂಬಾ ನಮ್ಗೆ ಬೆನಿಫಿಟ್ಸ್ ಕೂಡ ಸಿಗ್ತದೆ. ಪ್ಲಾಂಟ್ ಬೇಸ್ಡ್ ಡಯಟ್ ಬಗ್ಗೆ ಕೂಡ ನಾನು ನಿಮ್ಮ ಹತ್ರ ಮಾತಾಡ್ತಾ ಹೇಳಿದೆ. ನೈಸರ್ಗಿಕವಾಗಿ ಏನೇನ್ ಸಿಗುತ್ತೆ, ಆಯಾ ಸೀಸನ್ ಅಲ್ಲಿ ಸಿಗ್ತಕ್ಕಂತ ಎಲ್ಲ ಹಣ್ಣು ಹಂಪಲುಗಳಿರ್ಬೋದು ಅಥವಾ ತರಕಾರಿಗಳಿರ್ಬೋದು, ಅದನ್ನೆಲ್ಲ ನಾವು ತಿಂದಿದ್ದೇ ಆದ್ರಂದ್ರೆ ಬಹಳಷ್ಟು ಅದರಿಂದ ಉಪಯೋಗ ಆಗ್ತದೆ. ಮತ್ತೆ ಅದೇ ರೀತಿ ನಾವು ಸೆಡೆಂಟರಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಂತ ನಾನು ಅದ್ರ ಬಗ್ಗೆ ನಿಮಗೆ ಮಾತಾಡಿದ್ದೆ. ನಾವು ಒಂದೇ ಕಡೆ ಕೂತ್ಕೊಳ್ಳೋದು, ಓಡಾಡೋದಿಲ್ಲ, ಹಾಗಾಗಿ 108 ಕಾಯಿಲೆಗಳ ಆಗರ ಆಗ್ಬಿಡ್ತದೆ ನಮ್ ದೇಹ. ಸೊ ಅದಕ್ಕೆ ಆಗ್ಬಾರ್ದು ಅಂತಂದ್ರೆ ನಾವು ಆಕ್ಟಿವ್ ಆಗಿರ್ಬೇಕು. ನಾವು ಬರೀ ಕೆಲಸದಲ್ಲೇ ಅಷ್ಟೇ ಅಲ್ಲ, ನಮಗೋಸ್ಕರ ನಮ್ಮ ಕುಟುಂಬಕ್ಕೋಸ್ಕರ ನಾವು ಸ್ವಲ್ಪ ಅಂದ್ರೂ ಟೈಮ್ ತೆಗಿಬೇಕು. ಸೊ ದಟ್ ನಾವು ಯೋಗ ಇರ್ಬೋದು, ನಾವು ವಾಕಿಂಗ್ ಇರ್ಬೋದು, ಜಾಗಿಂಗ್ ಇರ್ಬೋದು, ಯಾವುದೇ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ ನಾವು ಮಾಡ್ತಾ ಇದ್ರೆ ನಮ್ಗೆ ಏನೇ ಸಣ್ಣ ಪುಟ್ಟ ಒಂದು ದೌರ್ಬಲ್ಯಗಳು ಇದ್ರೆ ಶಾರೀರಿಕವಾಗಿ ಅದನ್ನ ಕೂಡ ನಾವು ಮೆಟ್ಟು ನಿಲ್ಬೋದು ಅನ್ನುವಂಥದ್ದು ಒಂದು. ಮತ್ತು ಬಹಳಷ್ಟು ಜನಕ್ಕೆ ನಾವು ಹೇಳಿದ್ವಿ, ಬರೀ ತಿನ್ನೋದಂತಂದ್ರೆ ಪ್ಲಾಂಟ್ ಬೇಸ್ಡ್ ಫುಡ್ ಅಂತ ಹೇಳೋದು ಅಷ್ಟೇ ಅಲ್ಲ, ಅದನ್ನ ಯಾವ ರೀತಿ ತಿನ್ಬೇಕು ಇದ್ರದ್ದು ಒಟ್ಟಾರೆ ಅವ್ರು ಹೇಳಿರ್ತಕ್ಕಂಥದ್ದನ್ನ ನಾನು ಬಹಳಷ್ಟು ಜನಕ್ಕೆ ಹೇಳಿದೀನಿ. ನಾನು ಇನ್ನೊಂದ್ಸತಿ ಅದನ್ನ ರಿಪೀಟ್ ಮಾಡ್ತೀನಿ. ಇದನ್ನೆಲ್ಲ ಅವರು ಸುಶೀಲ್ ಶರ್ಮಾಜಿ ಅವ್ರು ಹೇಳೋದನ್ನ ಒಂದೇ ಮಾತಲ್ಲೇ ಹೇಳ್ಬೇಕಂದ್ರೆ, ನಾವು ಇದಕ್ಕೆ ಅವರು ಕರಿತಕ್ಕಂಥದ್ದು ಏನು ಅಂತಂದ್ರೆ, ಈ ಲೈಫ್ ಸ್ಟೈಲ್ ಫುಡ್ ಹ್ಯಾಬಿಟ್ ಗೆ ಸಂಬಂಧಪಟ್ಟಂಗೆ ಅಂದ್ರೆ ಅಹಿಂಸಾತ್ಮಕ ಜೀವನ ಪದ್ಧತಿ ಅಂತ ಕರೀತಾರೆ. ನಾನು ಅಹಿಂಸಾತ್ಮಕ ಜೀವನ ಪದ್ಧತಿ ಅಂತ ಹೇಳಿದ ತಕ್ಷಣ ಬಹಳ ಜನರಿಗೆ ಅಹಿಂಸಾತ್ಮಕ ಅಂದ್ರೆ ನಾವು ಹಿಂಸೆ ಮಾಡಿ ಪ್ರಾಣಿ ಪಕ್ಷಿಗಳನ್ನ ಕೊಂದು ತಿಂತೀವಿ, ಅದನ್ನ ತಿನ್ಬಾರ್ದು ಅಂತ ಹೇಳ್ತಾರೆ ಅಂತ ಅಲ್ಲ. ಅದು ನಿಮ್ದೆಲ್ಲ ತಪ್ಪ ಅಭಿಪ್ರಾಯ. ಆ ತರ ಅಲ್ಲ ಅದು ಊಹಿಸೋದು. ನಾವು ಸ್ವಯಂಕೃತ ಅಪರಾಧ ಮಾಡ್ಕೊಂಡು ಬೇಡದಾಗಿದ್ದೆಲ್ಲ ತಿನ್ಕೊಂಡು ನಮ್ಮ ಕೈಯಾರ ನಮ್ಮ ಆರೋಗ್ಯವನ್ನ ಹಾಳು ಮಾಡ್ಕೊಂಡು ಆಮೇಲೆ ಆ ಆರೋಗ್ಯವನ್ನ ಪುನರ್ ಪಡೆಯಲು ನಾವು ಡಾಕ್ಟರ್ ಹತ್ರ ಪದೇ ಪದೇ ಹೋಗುವಂತದ್ದು, ಸಾವಿರಾರು ರೂಪಾಯಿಗಳನ್ನ ಖರ್ಚು ಮಾಡಿ ಅದನ್ನ ಪಡ್ಕೊಳ್ಳೋಕೆ ಪ್ರಯತ್ನ ಮಾಡೋದು, ಅದು ಆಗೋದಿಲ್ಲ. ಸೊ ಈ ಸ್ವಯಂಕೃತ ಅಪರಾಧವನ್ನ ತಪ್ಪಿಸ್ಬೇಕು ಹೇಗೆ ಅಂತಂತಂದ್ರೆ, ನಾವು ತಿನ್ನೋದ್ರಲ್ಲಿ ಏನ್ ತಿಂತೀವಿ ಅನ್ನೋದು ನಮ್ಗೆ ಇರ್ಬೇಕು. ಅದು ನಮ್ಮ ಆರೋಗ್ಯಕ್ಕೆ ಯಾವ್ದು ಒಳ್ಳೇದು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಮ್ಗೆ ಅನುಕೂಲ ಇರ್ಬೇಕು. ನಾವು ತಿನ್ನೋ ಆಹಾರನೇ ನಮ್ಗೆ ಔಷಧಿಯಾಗಿ ಪರಿಣಮಿಸ್ಬೇಕು. ಅದು ಹೊರತುಪಡಿಸಿ ನಾವು ತಿನ್ನೋದನ್ನೇ ನಾವು ಮಾತ್ರೆಗಳನ್ನ ಔಷಧಿಗಳನ್ನೇ ಆಹಾರ ಮಾಡ್ಕೊಂಡ್ರೆ ನಮ್ಮ ಆರೋಗ್ಯ ಯಾವಾಗೂ ಸರಿಯಾಗಕ್ ಸಾಧ್ಯ ಇಲ್ಲ. ಸೊ ನಮ್ಮ ಆರೋಗ್ಯ ಸರಿ ಆಗ್ಬೇಕಂದ್ರೆ ನಾವು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗೋದು, ಔಷಧಿ ತಗೊಳ್ಳೋದು ಅದು ಎರಡನೇ ವಿಷಯ. ನಮ್ಮ ಡಾಕ್ಟರ್ ನಾವೇ ಆಗ್ಬೇಕಂದ್ರೆ ನಾವು ತಿನ್ನೋ ಆಹಾರದ ಮೇಲೆ ನಮ್ಗೆ ಸೀಮಿತ ಇರ್ಬೇಕು, ನಾವು ಮಾಡೋ ಕ್ರಿಯೆ ಬಗ್ಗೆ ನಮ್ದು ಕಂಟ್ರೋಲ್ ಇರ್ಬೇಕು. ಮತ್ತೆ ನಾವು ಇದನ್ನ ಮಾಡಿದ್ದೇ ಆದಲ್ಲಿ ನಾವು ತಿನ್ನೋ ಆಹಾರನೇ ನಮ್ಗೆ ಔಷಧಿ ರೂಪದಲ್ಲಿ ನಮ್ಮ ದೇಹದೊಳಗೆ ಹೋಗಿ ಅದು ಪರಿಣಮಿಸಿದ್ರೆ ಅದು ನಿಮ್ಗೆ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗುವಂತ ಅವಶ್ಯಕತೆ ಏನು, ನಿಮ್ಮ ಆಹಾರನೇ ಔಷಧಿಯಾಗಿ ಪರಿಣಮಿಸುತ್ತೆ. ಅದು ಬಿಟ್ಬಿಟ್ಟು ನಾವು ಬೇಡದಾಗಿದ್ದೆಲ್ಲ ತಿಂದು ನಮ್ಮ ಆಹಾರ ಪದ್ಧತಿಯನ್ನು ಹಾಳು ಮಾಡಿಕೊಂಡು ನಾವು ನಮ್ಮ ಆರೋಗ್ಯನ ಕೆಡಿಸ್ಕೊಂಡ್ಬಿಟ್ಟು ಮತ್ತೆ ಏನು ನಾವು ಊಟ ಮಾಡ್ತೀವಿ ಆ ಮಟ್ಟದಲ್ಲಿ ನಾವು ಮಾತ್ರೆ ನುಂಗಕ್ಕೆ ಶುರು ಮಾಡಿದ್ವಿ. ನಮ್ಮ ಮಾತ್ರೆನೇ ಊಟ ಆಗ್ಬಿಡ್ತದೆ, ಔಷಧಿನೇ ಊಟ ಆಗ್ಬಿಡ್ತದೆ. ಅದು ಆಗ್ಬಾರ್ದು ಅಂದ್ರೆ ನಾವು ಮಾಡೋ ಊಟನೇ ಔಷಧಿಯಾಗಿ ಪರಿಣಮಿಸ್ಬೇಕು. ಅದ್ರ ಜೊತೆಗೇನೆ ನಾವು ಏನು ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ, ಡೈಲಿ ನಾವು ಯೋಗ ಪ್ರಾಣಾಯಾಮ ಅಭ್ಯಾಸ ಮಾಡೋದ್ರ ಜೊತೆಗೆ ನಮ್ಗೆ ಪೊಲೀಸ್ ಅಧಿಕಾರಿ ಸಿಬ್ಬಂದಿಗಳಿಗೆ ಬಹಳಷ್ಟು ಜನರಿಗೆ ಗೊತ್ತು ನಮ್ದು ಎಷ್ಟು ವರ್ಸ್ಟ್ ಇದೆ ಲೈಫ್ ಸ್ಟೈಲ್ ಎಲ್ಲ, ಮತ್ತೆ ಎಷ್ಟು ಸ್ಟ್ರೆಸ್ ಅಲ್ಲಿ ನಾವು ಕೆಲಸ ಮಾಡ್ತೀವಿ ಅಂತ. ಅದರಿಂದ ನಾವು ಹೊರಗೆ ಬರ್ಬೇಕು ಅಂದ್ರೆ ನಾವು ಸ್ಟ್ರೆಸ್ ಮ್ಯಾನೇಜ್ ಮಾಡುವಂತದ್ದು ಗೊತ್ತಿರ್ಬೇಕು. ಅವರು ಸಿಂಪಲ್ ಆಗಿ ಓವರ್ ಅ ಪೀರಿಯಡ್ ಆಫ್ ಟೈಮ್ ಏನು ಮುಂಬರೋ ದಿವಸದಲ್ಲಿ ಅವರು ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಹೇಳ್ತಾರೆ, ಅವ್ರು ಸಿಂಪಲ್ ಟಿಪ್ಸ್ ಹೇಳ್ತಾರೆ ಹೇಗೆ ನಮ್ಮ ಸ್ಟ್ರೆಸ್ ಅನ್ನ ನಾವು ಮ್ಯಾನೇಜ್ ಮಾಡಬಹುದು, ಅದರಿಂದ ನಮ್ಮ ಆರೋಗ್ಯ ಹೇಗೆ ವೃದ್ಧಿ ಆಗ್ತದೆ ಅಂತ. ಮತ್ತು ಬಹಳಷ್ಟು ಜನ ನಾವು ಒಳ್ಳೇದು ಕೆಟ್ಟದ್ದು ಹ್ಯಾಬಿಟ್ ಗಳನ್ನ ನಾವು ಮಾಡ್ಕೊಂಡ್ ಬಿಟ್ಟಿರ್ತೀವಿ. ಅದು ಕೆಟ್ಟದ್ದು ಅಂತ ಗೊತ್ತಿದ್ರು ಕೂಡ ಅದನ್ನ ಬದಲಾವಣೆ ಮಾಡೋದು ಬಹಳ ಕಷ್ಟ. ಅದಕ್ಕೆ ನಮ್ಮ ಹಿರಿಯರೆಲ್ಲ ಹೇಳೋದು, ಒಮ್ಮೆ ಅದು ನಿಮ್ಮ ಅಭ್ಯಾಸ ಆಗ್ಬಿಟ್ರಂದ್ರೆ ಅದು ಸಾಯೋವರೆಗೂ ಹೋಗೋದಿಲ್ಲ ಅಂತ. ಆ ಹ್ಯಾಬಿಟ್ ಒಮ್ಮೆ ನಿಮ್ಮಲ್ಲಿ ಮೈಗೂಡಿಸ್ಕೊಂಡ್ರೆ ಕೆಟ್ಟ ಒಂದು ಹ್ಯಾಬಿಟ್. ಸೊ ಅದನ್ನು ಕೂಡ ಹೇಗೆ ಚೇಂಜ್ ಮಾಡ್ಬೋದು, ಅದಕ್ಕಾದಂತ ವೈಜ್ಞಾನಿಕ ಒಂದು ಅಧ್ಯಯನ ಏನ್ ಮಾಡಿದ್ದಾರೆ, ಅದನ್ನ ಯಾವ ರೀತಿ ನಿಮ್ಮ ಒಳ್ಳೆ ಹ್ಯಾಬಿಟ್ಸ್ ಗಳನ್ನ ನೀವು ಇನ್ಕ್ಲೂಡ್ ಮಾಡ್ಕೊಂಡು ನಿಮ್ ಜೀವನದ ಪದ್ಧತಿಯಲ್ಲಿ ಯಾವ ರೀತಿ ನಿಮ್ಮ ಆರೋಗ್ಯವನ್ನ ನೀವು ಒಳ್ಳೆ ರೀತಿಯಾಗಿ ಅದನ್ನ ಮುನ್ನಡೆಸ್ಕೊಂಡು ಹೋಗ್ಬೋದು ಅನ್ನೋದಕ್ಕೇನೆ ಈ IWSP ಒತ್ತು ಕೊಡ್ತಕ್ಕಂಥದ್ದು. ಅವರು ಸುಶೀಲ್ ಶರ್ಮಾಜಿ ಅವ್ರು ಹೇಳ್ದಂಗೆನೆ IWSP ಅಂದ್ರೆ ನಾವು ಬರೀ ವಿಜ್ಞಾನದ ಬಗ್ಗೆ ಮಾತಾಡೋದು, ಈಗ ಆಧುನಿಕ ಉಪಕರಣಗಳು ಅವು ಎಲ್ಲ ಏನ್ ಬಂದಿದಾವೆ ಅದರ ಬಗ್ಗೆ ಮಾತಾಡೋದು, ಔಷಧಿ ಉಪಚಾರ ಅದ್ರ ಬಗ್ಗೆ ಮಾತಾಡೋದಲ್ಲ. ನಮ್ಮ ಹಿಂದೆ ನಮಗೆ ಬೇಕಾದಷ್ಟು ನಮ್ಮ ಇತಿಹಾಸ ಇದೆ, ಈ ದೇಶದ ಭವ್ಯವಾದಂತ ಇತಿಹಾಸ ಇದೆ. ಅಲ್ಲಿ ನಮ್ಮ ಋಷಿ ಮುನಿಗಳು ಈ ದೇಶಕ್ಕೆ ಬಿಟ್ಟು ಹೋಗಿರ್ತಕ್ಕಂಥ ಅನೇಕ ಒಂದು ಅಂಶಗಳನ್ನ ನಾವು ಮೈಗೂಡಿಸ್ಕೊಳ್ಬೇಕಾಗಿದೆ. ಉದಾಹರಣೆಗೆ ಈ ಯೋಗ ಅಂತ ಇರ್ಬೋದು, ಅದು ಆ ಪತಂಜಲಿ ಸೂತ್ರ ಇರ್ಬೋದು, ಅವನ್ನೆಲ್ಲ ನಮ್ಮ ಹಿರಿಯರು ನಮ್ಗೆ ಋಷಿ ಮುನಿಗಳು ಬಿಟ್ಟು ಹೋಗಿರ್ತಕ್ಕಂಥದ್ದು. ಅದು ಮತ್ತೆ ಈಗ ಆಧುನಿಕವಾಗಿ ಇರ್ತಕ್ಕಂಥ ಏನು ನಾವು ಸೈನ್ಸ್ ಅಥವಾ ಮೆಡಿಸಿನ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತೀವಿ, ಇವು ಎರಡನ್ನು ಕಂಬೈನ್ ಮಾಡಿ ಇಂಟಗ್ರೇಟ್ ಮಾಡಿ ನಮ್ಮ ಓವರ್ ಆಲ್ ಹೆಲ್ತ್ ನ ಹೇಗೆ ಇಂಪ್ರೂವ್ ಮಾಡ್ಕೋಬೇಕು ಅನ್ನೋದನ್ನೇ ಅವರು ಡ್ಯಾಶ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ಮೂಲಕ ನಮ್ಗೆ ತಿಳಿ ಹೇಳಿ ಒಟ್ಟು 1 ತಿಂಗಳ ಕಾಲ ಪ್ರತಿ ವಾರ 3 ಸೆಷನ್, ಕಡಿಮೆ ಅಂದ್ರೆ 1.5 ಇಂದ 2 ಗಂಟೆ ಈ 4 ವಿಷಯ ಬಗ್ಗೆ ನಾವು ಆಗ್ಲೇ ಏನು ಸುಶೀಲ್ ಜಿ ಹೇಳಿದ್ರು ಡ್ಯಾಶ್ ಅಂತ, ಡಯಟ್ ಬಗ್ಗೆ ಇರ್ಬೋದು, ಆಕ್ಟಿವಿಟಿ ಬಗ್ಗೆ ಇರ್ಬೋದು, ಸ್ಟ್ರೆಸ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಬಗ್ಗೆ ಇರ್ಬೋದು, ಮತ್ತೆ ಲಾಸ್ಟ್ ಬಟ್ ನಾಟ್ ದ ಲೀಸ್ಟ್ ನಿಮ್ಮ ಹ್ಯಾಬಿಟ್ ಚೇಂಜ್ ಬಗ್ಗೆ. ಇದು ಎಲ್ಲಾನು ಮಾಡಕ್ ಸಾಧ್ಯ. ಅದಕ್ಕೆ ಉದಾಹರಣೆ ನಾನೇನೆ. 2.5 ವರ್ಷದಿಂದ ಫ್ರಮ್ ಡೇ 1 ಈ IWSP ಅವ್ರ ಜೊತೆಗೆ ನಾನು ಇಂಟಗ್ರೇಟೆಡ್ ವೆಲ್ನೆಸ್ ಸೈನ್ಸ್ ಪ್ರೋಗ್ರಾಮ್ ಜೊತೆಗೆ ನಾನು ತೊಡಗಿಸ್ಕೊಂಡಿರೋದ್ರಿಂದ ಅಷ್ಟು ಹೆಲ್ತ್ ಬೆನಿಫಿಟ್ ನೀವು ನೋಡ್ತಾ ಇರ್ತೀರಿ. ನೀವು ಅನೇಕ ಜನರಿಗೂ ಕೂಡ ಅನೇಕ ಪ್ರಶ್ನೆಗಳನ್ನ ನೀವು ಕೇಳಿ ನನಗೆ ತಿಳ್ಕೊಂಡಿದ್ದೀರಿ, ಯಾವ ರೀತಿ ಅಷ್ಟು ಆರೋಗ್ಯಕರವಾಗಿ ಒಬ್ಬ ವ್ಯಕ್ತಿ ಇರಕ್ ಸಾಧ್ಯ 55 ವರ್ಷ ವಯಸ್ಸಾದ್ರು ಅಂತ. ಅದಕ್ಕೆ ಜೀತಾ ಜಾಗತಾ ಉದಾಹರಣೆ ನಾನೇ, ಬೇರೆ ಯಾರ್ದು ಹೇಳೋದ್ ಬದಲು ಅದು ನನ್ನ ಮೇಲೆ ನಾನೇನೆ ಅದನ್ನ ಪ್ರಯೋಗ ಮಾಡ್ಕೊಂಡು ಇಷ್ಟೊಂದು ಒಳ್ಳೆ ರೀತಿ ನಾನು ಅದನ್ನ ಹೆಲ್ತ್ ಬೆನಿಫಿಟ್ ತಗೊಂಡಿದ್ದೀನಿ ಅಂದ್ರೆ ನನಗೆ ಸಾಧ್ಯ ಇದೆ ಅಂದ್ರೆ ನಿಮ್ಗಳಿಗೆಲ್ಲ ಯಾಕೆ ಸಾಧ್ಯ ಇಲ್ಲ? ಡೆಫಿನೆಟ್ ಆಗಿ ಹಾಗೆ ಆಗ್ತದೆ. ಆ ಮನಸ್ಸಿರ್ಬೇಕು ಅಷ್ಟೇ. ನಾನು ಮಾಡೇ ಮಾಡ್ತೀನಿ. ಅದನ್ನ ಏನ್ ಹೇಳ್ತಾರೆ, ಗುರುವಿನ ಗುಲಾಮನ ಆಗೋ ತನಕ ದೊರೆಯದಣ್ಣ ಮುಕ್ತಿ ಅನ್ನೋ ರೀತಿಯಲ್ಲಿ ಇವರಿಬ್ಬರು ಗುರುಗಳು ನಮಗೆ ಯೋಗಾನ ಹೇಳ್ಕೊಡ್ತಕ್ಕಂಥವ್ರು ಸ್ವಾಮೀಜಿಯವರು. ಆಮೇಲೆ ಈ ಸೈಂಟಿಫಿಕ್ ಡೇಟಾ ಮೂಲಕ ನಮಗೆ ಯಾವ ರೀತಿ ನಮ್ಮ ಆಹಾರ ಪದ್ಧತಿ ಮತ್ತೆ ನಮ್ಮ ಜೀವನ ಪದ್ಧತಿ ಇರಬೇಕು ಅಂತ ಸುಶೀಲ್ ಜಿ ಅವರು ಏನ್ ಹೇಳ್ಕೊಡ್ತಾರೆ, ನೀವು ಫಾಲೋ ಮಾಡಿದ್ದೇ ಆದ್ರೆ ಈಗ ನಾನು ಏನ್ ನಿಮ್ ಎದುರುಗಡೆ ಕಾಣ್ತಾ ಇದ್ದೀನಿ ಆರೋಗ್ಯಕರವಾಗಿ, ನೀವು ಎಲ್ರೂ ಕೂಡ ಅಷ್ಟೇ ಆರೋಗ್ಯಕರವಾಗಿ ಇರೋಕೆ ಸಾಧ್ಯ ಇದೆ ಅನ್ನೋದ್ರಲ್ಲಿ ಇನ್ನೊಂದು ಮಾತಿಲ್ಲ. ಅದಕ್ಕೆ ಉದಾಹರಣೆ ನಾನೇ. ಸೊ ಇದನ್ನೆಲ್ಲ ಒಳ್ಳೆ ಈ ಗುಣಗಳನ್ನ ನಾವು ಮುಂಬರೋ ದಿವಸದಲ್ಲಿ ಅಳವಡಿಸ್ಕೊಂಡಿದ್ದೆ ಆದ್ರೆ, ಅವ್ರು ಹೇಳಿದ್ದನ್ನ ಕೇಳಿ ನಾವು ಕಾಯ ವಾಚ ಮನಸ್ಸನ್ನ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿದ್ದೇ ಆದ್ರೆ ತುಂಬಾ ನಮ್ಗೆ ಅದರಿಂದ ಬೆನಿಫಿಟ್ ಸಿಗುತ್ತೆ. ನೀವು ಆರೋಗ್ಯಕರವಾಗಿದ್ರೆ ನಿಮ್ಮ ಕುಟುಂಬ ಆರೋಗ್ಯಕರವಾಗಿರುತ್ತೆ. ಕುಟುಂಬ ಆರೋಗ್ಯಕರವಾಗಿದ್ರೆ ಅಂದ್ರೆ ಈ ಸಮಾಜನೇ ಆರೋಗ್ಯಕರವಾಗಿರಕ್ ಸಾಧ್ಯ. ಜಗತ್ತನ್ನೇ ಕೂಡ ಬದಲಾಯಿಸುವಂತ ಶಕ್ತಿ ಆರೋಗ್ಯಕ್ಕಿದೆ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ನನಗೆ ತುಂಬಾ ಇದರಿಂದ ಬೆನಿಫಿಟ್ ಆಗಿದೆ. ಅದಕ್ಕೆ ನಾನು ಎಲ್ರಿಗೂ ದುಂಬಾಲು ಬಿದ್ದು ಇದನ್ನ ನೀವು ಮಾಡ್ಲೇಬೇಕು. ಇದು ಒಂದು ಸತಿ ಈ ಪ್ರೋಗ್ರಾಮ್ ನ ನೀವು ಕೇಳಿ ಇದಕ್ಕೆ ನೀವು ಅಡಿಕ್ಟ್ ಆದ್ರಿ ಅಂದ್ರೆ ಮುಂಬರೋ ದಿವಸದಲ್ಲಿ ಅದು ನಿಮ್ಗೆ ನೈಜ ಗುಣವಾಗಿಬಿಡ್ತದೆ. ರಕ್ತಗತ ಆದಾಗ ಬಾಯವಾಗಿ ಬೇರೆ ಏನು ಹೇಳೋದು ಬೇಕಾಗುದಿಲ್ಲ ಅಂತ ಅನ್ಸುತ್ತೆ. ಸೊ ನಾನೆಲ್ಲ ಹೇಳಿದ್ದು ಎಲ್ರಿಗೂ ಕೂಡ ಮುಟ್ಟಿದೆ ಅನ್ಸುತ್ತೆ ಮನಸ್ಸಿಗೆ. ತಾವು ಈ ಮುಂಬರೋ ದಿವಸದಲ್ಲಿ ಇದನ್ನ ನೀವು ಫಾಲೋ ಮಾಡ್ಕೊಂಡೇ ಹೋಗಿದ್ದಾದ್ರೆ ನೀವು ನಿಮ್ಮ ಕುಟುಂಬಕ್ಕೆ ಸಮಾಜಕ್ಕೆ ಒಳ್ಳೆ ಒಂದು ಕೊಡುಗೆ ಕೊಟ್ಟಂಗೆ. ಆರೋಗ್ಯಕರ ಸಮಾಜ, ಆರೋಗ್ಯಕರ ವ್ಯಕ್ತಿ ಈ ಸಮಾಜಕ್ಕೆ ಒಂದು ದೊಡ್ಡ ಆಸ್ತಿ ಇದ್ದಂಗೆ ಅಂತ ನಾನೇನು ಮತ್ತೆ ಒತ್ತಿ ಹೇಳ್ಬೇಕಾಗಿಲ್ಲ. ಹಾಗಾಗಿ ಇದನ್ನ ತಾವೆಲ್ಲ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿ ಅದನ್ನ ತಿಳ್ಕೊಂಡು ಮುಂಬರೋ ದಿವಸದಲ್ಲಿ ಮುಂದುವರಿತೀರಿ ಅಂತ ಅನ್ಕೊಂಡು ತಮಗೆಲ್ಲದು ಒಳ್ಳೇದಾಗ್ಲಿ ಅಂತ ಹೇಳಿ ಸುಶೀಲ್ ಜಿ ಅವರಿಗೆ ಮತ್ತೆ ಅವರ ಟೀಮ್ ಎಲ್ಲ ಸುಬ್ರತ್ ಅವ್ರ ಜಿ ಮತ್ತೆ ಎಲ್ಲ ಚಾರಮಿಡ್ ಟೀಮ್ ಏನ್ ಈ ಪ್ರೋಗ್ರಾಮ್ ಅನ್ನ ಇಲ್ಲಿ ಇವತ್ತು ನಮಗೋಸ್ಕರ ನಾವು ರಿಕ್ವೆಸ್ಟ್ ಮಾಡಿದ್ದಕ್ಕೆ ಅರೇಂಜ್ ಮಾಡಿದಾರೆ ಅವರೆಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ ಮತ್ತೆ ನಿಮ್ಗೂ ನಮಸ್ಕಾರ ತಿಳಿಸಿ ನನ್ನ ಮಾತು ಮುಗಿಸ್ತೇನೆ. ಜೈ ಹಿಂದ್.
Thank you, Anil Kumar ji, making a beautiful summary in Kannada. First time I'm hearing, trying to get most of it, but it's a wonderful way of IWSP in Kannada. So um, now I'll request, I'll tell few of the questions already appeared on my chat box. उसके बाद उसके बारे में actually Dr. Sharma will हिंदी में बोलेंगे उसका बारे में. The first in the chat box is why male gender is more prone to heart attack. जेंट्स को क्यों हार्ट अटैक ज्यादा होता है? शर्मा जी, इसका बारे में आपको क्या मत है?
हमारे जो मेल बॉडी और फीमेल बॉडी में काफी सारे इनबिल्ट डिफरेंसेस हैं. हमारे हार्मोनल मैकेनिज्म डिफरेंट हैं. सो कुछ ऐसे हार्मोन्स जो फीमेल में होते हैं स्पेशली ड्यूरिंग रिप्रोडक्टिव ईयर्स, वो उनको हार्ट अटैक से प्रोटेक्शन देते हैं जो मेल में नहीं होते. तो ऐसा है कि जो मेल में अगर 55 साल की उम्र में हार्ट अटैक होगा तो फीमेल में वही हार्ट अटैक 65 में होगा. तो इसीलिए फीमेल में हार्ट अटैक थोड़ा 10 साल लेट होता है. थोड़ी सी इस डाटा में डिसऑनेस्टी भी है क्योंकि हमारे सिस्टम में अगर मेल की चेस्ट में पेन हो तो हर तरह के टेस्ट किए जाते हैं, सब कुछ किया जाता है. फीमेल की चेस्ट पेन हो तो उसको इग्नोर किया जाता है. तीसरा कारण यह है कि फीमेल में चेस्ट पेन का सिम्टम जो है थोड़ा एटिपिकल होता है, अलग से होता है. ऐसा नहीं होता कि बिल्कुल यहाँ पे हवा तेज पड़ रहा है, प्रेशर पड़ रहा है, बाजू में जा रहा है, सांस फूल रही है, पसीना आ रहा है, चक्कर आ रहे हैं. क्लासिक सिम्टम्स नहीं होते, थोड़े डिफरेंट सिम्टम्स होते हैं. तो एक तो अंडर डायग्नोसिस है, एक डिफरेंट प्रेजेंटेशन है, एक हार्मोनल प्रोटेक्शन है. 3 कारण से फीमेल में हार्ट अटैक कम होता है और देर से होता है.
Thank you. I think this is quite an interesting reason. And there is some interesting observation also is a question. आजकल बहुत आदमी जिम में जाता है and young है, सोचता है they are quite fit and they feel like they are fit है, लेकिन उसको बीपी चेक करेगा तो प्रेशर ज्यादा है. ऐसा क्यों होता है? फिट होने से तो उसका प्रेशर भी ठीक होना चाहिए.
देखिए अभी पिछले हफ्ते ही एक 16 साल का लड़का देखा. उसने अपना वजन जो है 90 किलो से गिरा करके 75 कर लिया था एंड ही इज गोइंग टू द जिम. तो मैंने उससे पूछा क्या कर रहा है, तो उसने जो सप्लीमेंट्स की लिस्ट दी जो खा रहा है आजकल, ये प्रोटीन सप्लीमेंट, वे सप्लीमेंट, एनाबॉलिक स्टेरॉइड्स, इसके अंदर ऐसी काफ़ी चीज़ें हैं जो आपको अंदर से कमज़ोर करती हैं. मैं नाम नहीं लूँगा लेकिन बड़े फेमस एक्टर्स हैं जिनको हार्ट अटैक हो चुका है, स्टेंट डल चुका है, जिनकी बॉडी बहुत ज़बरदस्त बॉडी है और उन्होंने ये पदार्थ लिए. तो ये चीज़ें जो हैं, ये केमिकल्स जो लेते हैं, ये आर्टिफिशियल चीज़ जो लेते हैं, दैट्स नॉट अ गुड वे टू मेंटेन हेल्थ एंड दैट इज़ व्हाई दे आर गेटिंग हार्ट अटैक. Now, I did not tell you specific things, but if you remember 2 things, 5 for phytochemical, 5 for fiber. ये 2 चीजें हैं जो आपके अंदर हर तरह की तंदुरुस्ती लाती हैं. They clean your pancreas, clean your liver, clean your heart, clean your lungs. And both are only found in green leafy vegetables, colored vegetables, and fruits. That is why eating lots of fruits and lots of vegetables is healthy. Now, what are these people doing who go to gym? They don't eat fruits, they don't eat vegetables, they eat chicken, egg, fish, protein, whey protein, and they end up making external body beautiful, but the internal body is not beautiful.
Yes, I think that's what it takes time to understand the complexity how the system work. लेकिन यही तो हम लोग बाहर से ही सब कुछ दिखते हैं लेकिन अंदर क्या हो रहा किसी को पता नहीं है. Unless you undertake some kind of test and IWSP में बताया जाएगा क्या क्या टेस्ट करने से आपको पता चलेगा whether you are healthy or unhealthy. Okay, there is another very common question. हम लोग तो सोने के बारे में बहुत कुछ जानते हैं लेकिन सोना is such an important thing in your life every day. So, but how to improve the sleep? Do you have any specific recommendation?
Yes. So सोना जो है वो सोने से भी ज्यादा महंगा है. A good sleep is worth more than gold, है ना, आपको पता है ये. तो देखिए उसके लिए थोड़ी सी जैसे हाइजीन होती है, स्लीप हाइजीन होती है। अब मैं आपको 6 या 7 चीजें बताऊंगा। I'll tell you 6 or 7 things. Try to do whatever you can and what you cannot. Number one is 3 hours before you go to bed, there should be nothing in your stomach. So if you sleep at 10 o'clock, you finish eating at 7. After that, you don't eat or drink anything. So that's one important thing. 3 hours. Because if you go to bed with stomach full, you've eaten at 11 o'clock or midnight, inside all this digestion is going on. Your body is working inside and it's not letting you sleep. That's number one. Number two is dinner should not be very heavy. Eat up to 80% full. Number three is 3 hours before dinner, 3 hours before sleeping, there should be no caffeine, no coffee, no tea, no soda, no sugar beverages, and no alcohol. That's number two. Number three is 3 hours before you go to bed, you should not watch electronic devices. You should not be watching TV because TV gives you that flashing light. Flashing light is blue light. That blue light mimics sunlight. So when the sunlight, blue light comes in your brain, it tells your brain it is daylight. So the brain gets used to thinking it's daylight and it doesn't go to sleep and you don't sleep. So avoid devices, WhatsApp, iPad, iPhone, computers, laptops, TVs, 3 hours before you go to bed. Next thing is go to bed with a clean mind. Before you go to bed, think about things that are good, uplifting, ethical, moral, spiritual. Read something good from Holy Scriptures, read something from a book, read something from Quran or Bible or a Gita, and then go to bed. Then you go to bed with good thoughts in your mind and you sleep better. So try and follow these principles and see if your sleep is better.
Yes, thank you. I think it's a very important suggestion how to get a good sleep. There is some question on gastroenterology. What happens from this and what solution, what are the major symptoms? Briefly, can you cover? I know it's a subject by itself.
Yeah, so see, there's some symptoms in your digestive tract. That's what you're referring to, I suppose. I'll give you some examples. Heartburn, chest pain, sour eructations in your mouth, constipation, bloating, distension, gas, abdominal pain. These are all related to what you put inside your mouth. Whatever you put in the mouth goes in your stomach and intestine. So what you eat and how to eat influences all these symptoms. If your eating method is right, if you eat slow, you eat up to 80% full, don't drink too much liquids with your food, try and change your diet to whole food plant-based diet, avoid too much spices, avoid too much salt, avoid too much sugar, avoid too much oil, all these symptoms go away. Everybody I found out, I've been volunteering up and down the country in different hospitals, everywhere, everybody has stomach problems and everybody wants medicines. Everybody's taking protonics, omeprazole, pantoprazole, antacids, laxatives, probiotics. None of that is needed. Eat right, eat as we tell you, follow the food hygiene, follow the eating hygiene, follow the right food, and you will not have any of these symptoms. Before there's any question, because there are a lot of Hindi speaking people and we keep talking about lifestyle. So for a Hindi speaking people, lifestyle, जीवन पद्धति क्या है? सिर्फ 3 बातें याद रखिएगा, खान पान, रहन सहन, सोच विचार। इसके अलावा हम अपने प्रोग्राम में कुछ नहीं करते। आपको क्या खाना है और कैसे खाना है ये बताते हैं, क्या पीना है क्या नहीं पीना है ये बताते हैं, कैसे रहना है, एक्टिव रहना है कि लेजी तरीके से रहना ये बताते हैं, कैसे सहन करना है ये बताते हैं, कैसे सोचना है, किस तरह की सोच अपने दिमाग में आप डालेंगे, क्योंकि जो सोच डालेंगे वैसा ही आपकी हैबिट होगी, और कैसे विचार आपके दिमाग में आने चाहिए ये बताते हैं। तो खान पान, रहन सहन, सोच विचार को जीवन पद्धति या लाइफस्टाइल कहते हैं, और इसको बदलने के लिए जो भी वैज्ञानिक तरीके हैं, जो कि वैज्ञानिक साहित्य में पब्लिश हुए हैं, वो हम आपसे डिस्कस करेंगे।
Thank you, Dr. Sharma. The next question is, low BP कैसे maintain किया जा सकता है?
Sorry?
It is how to maintain low BP. I mean, how to maintain the blood pressure under control. That's what I hope the question is.
Yes. Very good question. So remember I showed you one slide, and can you please, Subhuta, also put it on WhatsApp of everybody that attended those practices that lower blood pressure by 40 millimeter of mercury. Okay, if you change your diet to full food plant-based diet, that lowers your blood pressure by 10 to 15 millimeter of mercury. Remember, I told you only one pill only lowers your blood pressure by 10 to 15 millimeter. Cutting back on salt. Let me tell you how to cut back on salt. Changing the salt to potassium salt, doing aerobic exercise, doing isometric exercise, and doing strength training exercise. Now, you don't need to know how these are. If you're doing yoga, you're doing all three. And avoiding alcohol. If you do these practices, you can lower your blood pressure by 40 millimeters of mercury and eliminate blood pressure medicines. 1 kilogram loss in weight lowers your blood pressure by 1 millimeter. So if you lower your blood pressure, your weight by 10 kilograms, you lost 10 millimeter of blood pressure right there.
Okay. We'll put it in the participant के लिए एक WhatsApp का एक slide है जिसमें all the details will be covered. You will know by that. There is a interesting questions. Normally, very difficult. I find and very controversial answers also. Is how to prevent hair fall? What cause are the reason the hair falls other than the genetic? You have any answer?
हिंदी में बोलूंगा, गलत आदमी से गलत सवाल पूछ रहे हैं. You're asking the wrong question to the wrong man. If I knew the answer, my head would not look like this. Now, there are many ways you can cover this hair loss, but I love my head the way it looks. So I've never tried anything. I don't wish to try anything. And I don't think that by losing hair, I lost anything inside. So the greatest thing about hair loss is learn how to accept it. And I say this to all my friends. I said, look, God created two types of heads. He created ugly looking heads and he created beautiful looking heads. When he looked at the ugly looking heads, God was disappointed. So he said, what should I do? Then God decided to cover those heads with hair. And the ones that were beautiful, he left them like that for everybody to see. So don't fight hair loss. If it happens, fine. I lost my hair when I was 45. Maybe radiation that I worked in the cath lab for so much. So anyway, the long and short is that love yourself the way you are. I love myself the way I am. I have never desired to get more hair on my head. And I do not know how to get more hair on my head. And if I knew it, I would have probably used it on myself.
Okay. I think that's a interesting way of presenting, and people should enjoy their own look rather than complain, and trying to improve the appearance external rather than should think what is internal to you, which is causing the problem.
Absolutely.
There's a question, I don't know what is the question. It says no BP, no sugar, but headache and telisuttu. I don't know what does it mean, but no BP, no sugar, but headache. That's how it's possible.
Yeah, headache is a very common and non-specific symptom. So you think about when you get headache, first of all, see what is around the head. So if you address that first and take care of that, see there are eyes around the head. Maybe you have a refractive error. Go to an optometrist and get your eyes checked out. That's a very common cause of headache, right? Headache could be a problem infection in your teeth around here. Make sure you get your teeth checked out. Headache could be because of a problem in your ears. Get your ears checked out. And the commonest cause of headache is tension headache. If you're not sleeping well, if you're stressed out, if you are not getting enough rest, if you're not exercising, you get headache. So look at your lifestyle and see what is there which you can change. And if all that does not help you, then you should see a doctor to see is there any serious cause for the headache. And blood pressure obviously is one of the common causes, but you said you don't have it. So get your eyes checked, teeth examined, look at your ears, and watch your lifestyle. Are you getting adequate sleep? Are you getting adequate rest? Are you exercising? Are you under stress?
Yes, I think those are the very forgotten areas. We don't think that will create a headache. I think people should be aware, and they'll learn more when you actually IWS में जब join करेगा. Then I'll briefly tell how to join the IWSP. IWSP join के लिए there is a very simple process. We have our website, and normally everybody who are joining, they pay for that whole course, full course fees quite. It's a reasonable 2,500 for the whole course, attending all the classes. But to make sure that you get the full benefit, and especially for the police department, we use a special code called KSP 60. If you use that, you get a special discount and you pay only $9.99. With that price, you can attend all the classes, all those practices. It's not only listening, but you have to practice. There's a practice session also. And after, beyond the practice, you have a question, you can ask question. And beyond it, if you really want to continue further for the rest of the year, you can attend every Sunday morning and ask your question and attend the practice. So that's a beautiful way. You remain connected, and आपको सबको जो पूछने हैं सब कुछ live में आपको clarify हो जाएगा. So this is a very unique program. I at least expect most of you will love this and enjoy it and improve your health by this way. If you don't have any problem, but still you can attend, and so that problem should not appear in future. So it's a proactive wellness healthcare program. I will say that way. It's not that you have to be ill to attend wellness program. If you don't have any problem now, it may appear after 1 year down the line. Suppose you are retiring after 2 years, you'll see all the problems coming after retire. But if you attend today, you will be assured that those kind of illness won't appear once you have a different kind of lifestyle. It will make you total drastic transformation in your way of thinking how the wellness work. So thank you all for joining and listening to this special lecture and interaction. And also you have a helpline number. Please see this number. If you have any question, you can WhatsApp us. You can also call us this helpline number. आपको कुछ पूछना है तो पूछिएगा, कन्नड़ा में, हिंदी में, इंग्लिश में. हम लोग कोशिश करेंगे to answer those. With these few words, yes, I'm very happy and thrilled, and like to congratulate for you. All of you attended this program, and surely we'll love to see you, that you get connected more and more with us, and we'll try to see how much whatever we learn we like to share and improve your current factor of health, and you become more well today and for future also. Thank you very much, and thank you, Dr. Sharma, for your patient staying and attending all those questions, even though it is some of them may not be fully relevant for this particular program. Thank you, and thank you, Mr. Anil Kumar, for your beautiful way of saying the whole program in Kannada, which actually is beyond me to grasp it. And surely we'll try to make sure similar program will try to translate in Kannada for future for the whole Karnataka, so that can be spread across with the more population who doesn't understand English and Hindi. So thank you very much. If you have any query, please send us those, call us or send an email. We'll be try to see all can be answered in your own way. Thank you, namaste, and really happy to be with you today. Namaste.